by the White House. In Georgia, it turns out that half of the 220,000 enrollees have not paid yet. Meantime, in California, the people who are paying aren't getting what they paid for. Customers are having trouble finding doctors. Imagine that. They are the Obamacare homeless.
Thin Ong was thrilled to qualify for a subsidy on the exchange. She pays $200 a month in premiums. But now the single mother of two is wondering, what for?
Yeah, I signed it. I got it. But where's my doctor? Who's my doctor? I don't know.
The lists that were provided, they're calling only to be told we're full, or we're not taking patients, or that doctor actually is not participating in that plan.
And Nguyen says while the free clinic isn't technically supposed to be treating former patients they signed up for insurance, they can't in good faith turn them away.
We have a crisis.
UCSF Dr. Kevin Grumbach calls the phenomenon medical homelessness, where patients are caught adrift in a system woefully short of primary care doctors.
Problem is, many doctors are not participating in Obamacare, and the ones that are getting slammed, overwhelmed by all the new patients. So what can these Obamacare homeless do? What are the options? Joining me now, private medicine advocate and Obamacare expert Patricia Newman.
Hi.
Patty, this is a terrible situation, as we heard just now, that it's being called a crisis. It is a crisis. If you sign up for a medical plan and you expect to, we can't expect to keep our doctor. We know that was a lie, right? But at least maybe we can see a doctor, repeatedly, and now they have none?
It's unbelievable, but it is expected. Because the insurance companies that are offering these Obamacare plans have very small networks. So the physicians that are indeed participating have they only have so many hours in the week. You have to know that the insurance commissioners in different states, they have rules about how long your patient can wait before a physician gets penalized.
Right.
For making them wait too long. So their alternative to that is to close their panels. So maybe while at the beginning they were going to participate, when they started seeing the rush of all these patients, they closed their panels. So now these patients don't have a place to go.
Hey, what's a panel, real quick?
A panel of patients, meaning you open your doors to a new insurance plan. You say, okay, I'm going to take the bronze plan. And as you see people enroll and pick you as a primary care physician for their group, you see that now you have 500 new patients and you're not set up to be seeing those many patients. So you call the insurance company and say, I can't take any more, so let's close my panel.
Okay. So it's basically allowing the enrollees in.
Right.
So what are these people to do?
There's going to be two different classes of consequences here. The people that have the money, they can go to a private physician and pay cash for the services. This is happening at our practice, where patients were given a choice between their existing private policy that got canceled to the new policy that has this humongous deductible, the premium's higher, and they're trying to minimize those premium payments. So what they do is they get the cheapest one they can, and then they show up at our office and just pay cash for their services because it's a lot less expensive than covering their deductible. So there's that class of patient, and there's the other class of patient that, as you know, is going to either be going to the community clinics or is going to end up in the emergency room.
Right.
And that will increase the amount of resources that healthcare is going to be losing.
Right. And Obamacare was supposed to stop people from going to the emergency room. Remember that? But this first class you were talking about, they're paying for Obamacare, and they may be paying a lot. Who knows? Maybe they're getting subsidized, maybe not. Who knows? But they're paying, and then they're going to be paying cash on top of their monthly premiums, right?
That's right. And I mean, the one patient I can think of right now is this patient's paying $1,000 premium a month. But because we don't participate in that plan and she doesn't want to go somewhere else, she comes over to our office, pays $95 for a visit if she gets sick. And so she's trying to make her dollars, just last longer.
So is it my imagination, or are the networks, as you call them, shrinking? Are there fewer doctors out there? Are there just fewer doctors participating? What's going on?
Well, you have this huge number of new patients that are insured. You remember they expanded the Medicaid program by from 100% of poverty to 400%. So you have this huge number of patients, the majority of which are being subsidized, and you have either the same number of physicians or less. And the reason you may see less in the future is because with all the Obamacare regulations, physicians are not liking all the amount of paperwork they have to do, all the requirements they have to meet, their pay for performance penalties if you don't do something that they expect you to do. So they're going, I don't want to play this game, so I'm just going to retire. When most of the regulations hit is 2018, and that's when you're going to see a huge shortage of primary care physicians. I
want to shift gears just a hair here, and that is the census. The Obama administration has now changed basically the wording in terms of asking about health care on the census now, which to me changes the entire benchmark, which allows the Obama administration not to compare apples with apples. It's a brand new ballgame here, right?
It is. I mean, they come up with this new survey that they do annually, and this is part of one of the projects that the Census Bureau does. And suddenly they change all the questions right as Obamacare is being implemented. Well, they did a test run last year, which those figures are not going to be used, but they did talk about the fact that the new survey makes the respondents show there's a lot less uninsured people. Now, remember that 37 million, almost 40 million uninsured people? Well, with the new survey, it seems like there's only 31 million. Now, if you compare that to what the CBO said about at the end of all this mess, we're still going to have 30 million uninsured, that's 1 million difference for this the whole system being turned upside down.
Yeah, so we turned ourselves inside out to ensure a very small percentage of this country.
And the other thing that you have to remember is, do you trust the Census Bureau? When they ask you if you are insured or uninsured, you know that it is the law that you have to be insured. Are you going to tell them the truth if you're not insured? I mean, there's so many things. They don't have any of the data for their statistical studies that's being offered to any of us that are interested. So how can you trust that data?
How can you trust this White House? It doesn't politicize anything ever. That's what they say.
Exactly.
Patty, thanks for all that.
Thank you.
Coming up next, anybody but Hillary, as the Daily Ledger continues.
Sure, the Emmy Awards